Medicare Mark Fuchs here. I wanted to jump on and do a little bit longer video about this situation. I did a 30 to 45-second video, real high level, what is happening right now. And for those who like a little bit more explanation, I wanted to jump on here and offer a little bit more explanation as to what we are seeing in this marketplace and why we are seeing it right now. Um, the way Medicare Advantage plans work is that insurance carriers have to submit to the federal government in June what their plan is going to be for the upcoming year. Okay. So in June of 2026, we are starting to get an idea. These insurance companies are getting an idea of what they are going to be offering for the 2027 year. Okay. When these insurance companies are putting together your Medicare Advantage plans, they're looking at maximum out of pockets, they're looking at copays, they're looking at extra benefits, they're factoring all of those benefits and all of those packages and copay costs in, and they're looking at what is happening with the reimbursement costs or the reimbursement from CMS to the insurance carrier. They're looking at the overall health of the region, of the area. Are people healthier? Are people getting less healthy in that region? And they're looking at the care of costs. What is happening in the hospital systems, and what are our contracts with the hospital systems? How much are we going to have to pay them to administer care? And they factor all of those things in, and then they put together these Medicare Advantage plans, and then they hand that over to the government, to the CMS, the Centers for Medicare Medicaid Services, and then they approve, disapprove, or ask for a revision, right? So for the next 3 months, you have the insurance companies and the federal government talking and revising the Medicare Advantage plans that you are going to be offered from October to December. Okay. Why this is important to us right now with regards to Providence is because Providence has not submitted a 2027 Medicare Advantage plan, right? They are not submitting the plan. And by not submitting the plan, they are not going to have a plan to offer in 2027. And they are getting ahead of this. They are coming out right now and saying that. So that's why we are talking about this right now instead of talking about it in October or September or July, right? Like we got 2 weeks before the deadline of these plans being submitted to the government, right? So that's the world that we're working in. Why is Providence doing this? Man, your guess is as good as mine. I've been on the phone with Providence. I've been on the phone with other insurance carriers. I have some experience with this stuff, and I have some thoughts and I have some ideas. But the fact is that none of us have anything concrete. What we've been discussing and what I've had people saying and telling us is essentially that Providence can't be in the insurance business and the healthcare business at the same time, and the insurance business is not paying enough to keep the healthcare business open, right? The insurance business is costing them money, and the healthcare business is costing them money. And at some point in time, right, something's got to give. And Providence is not going to shut down their hospitals. They're not going to shut down the brick and mortar version of Providence. This is the easiest thing to give. They have sold the Medicare Advantage book to a national carrier. I don't know who it is. I have some thoughts, and there's some rumor and conjecture, but I'm not here to share rumor and conjecture. But they have sold the business to a national company, and we'll see what happens, right? Like that company had to submit their plans in June too. So we'll see what happens. Between now and then, right? Between now and 2027, if you have a Providence Medicare Advantage plan, it is business as usual. Go see your doctors, go get your surgeries, go like take care of yourself, right? Like that's number one. Your plan is still active, it is still effective, it is still everything that is still there, right? So that doesn't change. The alternatives that we're going to have, but I digress. The From October to December, we're going to have to make some changes. If you're a Providence Medicare Advantage member, you're going to have to make some changes again for some of you, right? And and I know that that's jarring. I am actively at work. I have been talking to other insurance carriers already, and talking about what are some of the things that we can do. What are some of the exciting things that exciting for me, things that we can do to help people, and to actually maybe come out of this thing. You may come out of this thing a little better than what you were with one of their plans, anyways. Right? Like that's the goal. The goal is that we always go forward. So we're working on that. We're working on that for people, for anybody who calls me. We're working on that. And but I wanted to offer kind of some insight into what's really happening here. And if somebody is interested enough to stay on this thing and watch all 6 minutes of this, man, thank you. Thank you. I appreciate it. And if you have any questions, please feel free to schedule a time with me. I'm always here. I'm always available to answer questions and to be of service. So thank you. I hope you have a great weekend.